Duke Majan. It's May 20, 2025. Our patient is a Floridian. He travels here with back pain. I'm going to inject some local. And he has two discs that need to be repaired, the L45 and the L5S1. These discs are damaged and they're the source of his pain based on our examination called the Duke Spine exam, which is basically a combination of physical exam, our experience, and the findings on the MRI scan. So we use experience, MRI findings, and the physical exam to identify the source of pain. On the right side, we're going to be fixing the L5S1 and the L45. On the left side, we're going to be fixing the L45. So he has two tears on the right, one on the left, that need to be repaired. Now, Henry, there are many causes of back pain, 30 to be exact. Let's share with our audience the 30 different causes of lower back pain, and then we'll talk about this patient's cause. Sean? I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L45, followed by L5S1, then L34. The L12 and L23 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L12, L23, L34, L45, and L5S1. The most common facet joints to cause chronic back pain are L45, followed by L5S1, followed by L34, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. AP. All right, welcome back. We are in the process of accessing this patient's discs, specifically the L45, L5S1, using a needle, making a small incision in the skin, and basically we've succeeded at getting to the L45 shot. The L5S1, I'm sitting right behind the disc. And what I was telling my team while you guys were watching our video is that this patient has a very interesting spine. It's not normal. His spine is very anterior, meaning it's towards the floor. It's away from here. It's on the opposite side of the body, which makes the surgery much more difficult to do. So I've been struggling a little bit to get the needles into the right spot. Oh, in addition to the fact the spine is anterior, we also have very big facet joints. So with the facet joints being big, you can see that on the X-ray shot. Jordan, you want to show them the big facets? His spine is also rotated. Sean? Yeah. That's not the facet. It goes back further. You see all the way there. That's the back of the facet. Yes, that gigantic thing is the facet joint. Now show them a normal facet joint above. Yes, that's not it. Go down, down, and circle there. That's a no, a little bit towards the back. That's the normal facet joint. And look at the one below. It is gigantic. So he has a gigantic facet joint at 4-5, Sean, which makes getting into the disc much harder. On top of all that, his spine is anterior. It's very far towards the front, towards the floor. All right, let's get an AP view. But we're getting it done. It's just a lot harder than I was hoping. All right, perfect. So we're doing bilateral 4-5. Everybody agrees. And we're doing right 5-1. Well, I'm not in 5-1. Any questions about the video you saw?
At this moment, no current questions.
How is he, Dr. B? Oh. How bad is that on a scale of 1 to 10?
Give us a number. I'm sorry, I can't hear you. What'd you say? 5.
What's the highest it goes?
7.
Is that where you get your back pain? All right, we got good news for you, my friend. When you wake up, that pain's going to be gone. We need you to count from 1 to 100 out loud so we can put you to sleep, okay? Huh? We're done. We're done. Nice and loud so we can hear you. Nice and loud. Where are we at, Henry?
As of now, no current questions,
All right.
but
So
everything's going smoothly so far.
we are in the disc at 4.5. We did a test. It was 7 out of 10 concordant. That's where he gets his back pain all the time. And as I was saying to you guys earlier, he's got a very unusual anatomy with a very anterior spine and very large facets, making this a very difficult access on the right side. The left side was a little easier. Shot? Why does it look like we're going to 5-1? No? Shot? It's just double overlay. Perfect overlay. Let me know when I can proceed. Shot. See how steep that angle is, Berndes? It's like unbelievable. Hold on. Let's see. Yes, go. What does this guy do? Is he a mechanic? Yes. I remember. He's going to have to be careful with his back till it heals. All right, Henry, where are we at?
As of now, no current questions, but we did get a spike in viewership, so hopefully we'll get one soon.
All right, folks watching, you are watching the Duke Laser Disc Repair. It is laser spine surgery, the very best laser spine surgery in the world. Our patient is a mechanic. He works in the auto racing world. I can't give you any more information than that. He's had back pain now for 20, lower back pain, 25 years. And he found out about Duke Spine. We did a MRI review. And here he is, having his back fixed. All right, so we're going to use the laser to clean out the painful disc and get rid of his back pain permanently with a state-of-the-art treatment available only here at Duke Spine. Why don't you, hold on. Why don't you show our audience, Henry, show our audience how does a disc injury cause so much back pain and how we fix it. Sorry, Dr. Berndes, go ahead. What were you saying?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. You can see from our video that the way most people get a disc injury is through trauma. Actually, everybody gets a disc injury through trauma. And it could be a sports-related injury or a car accident or a slip and fall. But basically, there's some trauma which causes a tear in the disc, which then causes herniation, which then causes inflammation, which then causes back pain, which then causes also leg pain, leg symptoms. And the Duke laser disc repair is the only surgery in the world that specifically treats the tear in the back of the disc called the annular tear. And the only way to fix the annular tear is with a laser, which is what we're doing. You can see from our surgery the laser fiber, which is the glass tip, is about 1 millimeter wide. That gives you a reference point as to how big the laser fiber is. The inside of this tube is 5.5 millimeters wide. So this is a very small area that we're working in. It's just magnified using a camera and lens system. This is what we call endoscopic surgery. Okay, these are all pieces of herniation that are floating up and out. You can see them.
We have a question
Yep,
coming from Pure Honest Very Caring on Facebook,
sure.
asking what is the difference between epidural L5S1 injection, joint epidural injection pain management. Asked me which one do you want because there's no S1 disc completely dry because we can't seem to numb the S1. It wears off in less than a day after the injection.
Yeah, so I believe what you're asking is which should you do? Epidural, which is good for disc pain, or a facet joint injection, which is good only for facet pain. Here's the thing. Those injections are never going to fix your problem. They're always temporary. They're always going to wear off. If you get a week, that's a week of pain relief. Wonderful. But they're not a solution. So don't think of injections as a way to get rid of your pain. So you're talking about it wears off quickly, right? It wears off after 1 day. That's typical for injections. They're going to wear off. What you really need is a fix. And the only way you're going to get fixed is if you come here to Duke Spine and get fixed. So if you are okay with just having a treatment that wears off quickly, and keep doing what you're doing. But the pain management doctor will never, ever, ever cure your pain, ever. That's why they're called pain management doctors, because they manage pain. Manage means like you manage your money, right? You got to have money to manage money. You got to have pain to manage pain. Pain management doctors don't cure pain. They manage pain. So you're going to still have pain. You're just going to keep trying different things. And they will never, ever, ever get rid of your pain. If you want to get rid of your pain and you want a permanent solution, you come to Duke Spine Institute. That's the best advice I can give you. You can do the epidural. You can do the facet block. It doesn't matter. They're both going to wear off if they work. And they may not even work. All right. Just about done here. This is part of the tear. You can see the herniation still there. A little bit blue.
Yes, we can.
We're just about finished with this right L4-5. Now, there should be a needle down there, right, Luis? A needle. Might see it. But this is the tear. We're cleaning the tear. We're cleaning the tear so that it will heal Folks, the reason we use the laser to clean all this junk out of here is so that the disc will now heal. If we don't clean this tear, the disc will never heal. Huh? No. That blue stuff is herniation, so we're going to keep working on this until we get as much of it out as we can. And that will allow the disc to seal itself. All I can tell you folks watching is you're all looking for answers to get rid of your symptoms. The treatments you're looking at, unless they're done at Duke Spine, are either not going to work for you or they are highly invasive and dangerous. And they have complications. How do I know? Because I know the entire spine field. I'm a neurosurgeon who specializes in spine. And I've seen everything. We have our pain management doctors here. We have physiatrists, interventional pain management, orthopedic pain medicine, electrodiagnostic medicine. We have all those specialties, spine surgery, neurosurgery. I've done all the types of spine surgery you can do. Okay, I'm trained at a top neurosurgery program. We did everything, fusions, artificial discs, spinal cord stimulators, laminectomies, discectomies, injecting materials into discs. I've seen it all, done it all, and of all the treatments in the world, the only one that works is this one and fusion. And you don't want a fusion. Fusions are bad. Fusions take away pain. Even artificial discs don't work. Okay? They're supposed to work, they're supposed to help, but they don't. A lot of complications, very poor results. So, shots will always just be shots. They'll always be temporary at best. I can inject steroid into your arm, and that steroid medicine will go to your whole body and it will help your back pain. That's why when you go to the emergency room, the doctor takes a needle and sticks it in your butt muscle, and injects medicine into your butt. Okay? And then it works everywhere, right? That's because it's absorbed by the blood vessels in your butt muscle, which is highly vascular, and it distributes to your entire body, and it has a systemic effect on you. There's nothing magical about an epidural. It's just a needle going in your spine. That medicine, once injected, will work in your spine, but it'll also go to your whole body. All your joints, your knees, your hips, your shoulders, everything. Those pills, those shots, I mean, are never going to fix your problem, ever. They're only going to make you feel good for a little while. It's like getting a high, except it's a prolonged high. Steroids are anti-inflammatory. By the way, somebody asked earlier about, does the laser remove fat? Yes, it does. That's fat right there. Right there at 11 o'clock is fat. I just zapped it away with the laser. Now, we're not trying to remove fat, but the fat gets in the way. Oh, you see that sparking right there? That means I hit the other needle. Or something close to a needle, like calcium. Creating a little lightning. All right, just about finished here. There's some more fat. So far, everything's going really well for this patient. Now, we've shown the audience the causes of back pain. We've shown the audience how the Duke laser disc repair works, correct?
Correct.
All right, good. Any questions?
At this moment, no current questions.
All right.
In the meantime, why don't we show the audience the second the second cause of back pain, which would be the facets.
Second most common cause of back pain.
Exactly.
I love it, Henry. That is a great idea. The facets.
Exactly.
And we fix it.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
That's it, Jordan? Yes, sir. All right, we'll come back. Sean? See if you can give me a better picture at 5'1". It's not horrific, but it's not great. That might be the best we can do, huh? Sean? Sean? AP? Sean? Lateral? Ah, come on. Give me a true AP. Oh, it's nice. Lateral? It's right there at the back of the disc. What we call the introitus. Whatever works, right, Burndas? Introitus, coitus, schmoitus. Introitus means the entrance, the opening. Well, the problem is the disc is very collapsed and it doesn't want to accept the needle. So the needle is sitting at the introitus, or back of the disc in the foramen. I'm going to try to open things up using the dilator. Shot. Let's see what we can do. But he's got a big facet here that's kind of keeping me from getting where I need to go. And he's got a collapsed disc. But we've been here before many times, and usually we can get in there and successfully fix the problem. And I want to help this poor man because he's in a lot of pain. Any questions, Sean?
At this moment, no current questions.
Let me see, yeah. Sean? Well, we're in. Wasn't pretty, but we got it. 5'1" is very difficult to get into in some patients like this one. But the reason why it's so difficult, his spine is very far forward, which makes it a steep angle for me to work at. And then he's got this collapsed disc. And then he's got this enlarged facet. So you add all that stuff together, and it really makes it so hard to get there. But we're there. That's the good news. Good job, Luis. Yeah. You got him sleepy, sleepy? Yeah. The more asleep he is, it helps. We're talking about millimeters, folks. Millimeters. Not even a full millimeter, like sometimes half a millimeter. We call it, in racing, they call it the squish. The distance between the tip of the spark plug and the igniter pin. And that squish is measured in fractions of a millimeter. That's what we're doing here. We got the squish right here. He can appreciate that. And every little quarter millimeter, half a millimeter, look at all that inflammation. Very, 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 very full of inflammation. But despite that, there's going to be a little spot right there. You guys see it? The red? The soft tissue?
Yes, we do.
That's where the pain comes from. So it doesn't matter. The disc is degenerated. All that matters is that we get that little tiny area. It's about the size of a millimeter. And thank you. And if I can get this right here and zap it away, then there's a bone spur there too. His pain will go away. Yeah, you guys see the bone spur kind of wibbling around now?
Yes, we do.
So I kind of loosened it up by putting in the dilator, and now it's wobbling around. See if I can grab it out of there. That bone spur is just hanging on there. Yeah, got part of it. Any questions?
At this moment, no current questions. We did get more of a viewer spike, so at least that.
Good, Henry. You're doing some experimenting, huh?
Exactly.
I like it.
Yeah, I cannot complain there. I just
Well,
like comments and questions.
Yeah, the problem is, to be honest, this stuff with the back, it's it's very confusing for people because they have back pain, they go get an MRI, and the radiologist finds all these things like spinal stenosis or facet arthropathy, facet hypertrophy, broad-based disc bulge, right? You got all this stuff that's mentioned in the report, and yet as a patient you think all of them are important, right? All of them have to be addressed, but they don't. That's where it's important to have somebody like Duke Spine Institute tell you what needs to be fixed. Because for the 10 things that you find on the report, only a few of them actually need to be fixed. The other ones are normal part of aging. You're going to have that with every person. And there's no reason to do any treatment. All right, we're just about done here with this disc. I'm going to move over to the other side. As I said earlier, look laterally. This is the lateral part right here. Lateral means to the side of the spine. A lot of calcium deposits here. That's what's sparking. And we're going to head over to the left side and do the L45 on the left. So I'm done here. Went really good. Little bone spur right there. You guys see that? Oh yeah.
Yes, we do.
Oh yeah. Big mama. Come to daddy. Come to daddy. Oh yeah, that's a piece of bone spur we just amputated and we're going to get rid of, and then we're done here. See, got it. Lovely. I'm not leaving without you. Don't even think about it. There it is. We got it. I need some applause, please. Thank you. We're done. Thank you. Thank you. Thank you. Thank you. All right. Done with the right 5-1. Yes, sir. Any questions?
Yes, we have a long question coming from Pure Honest, Very Caring, once more on Facebook,
Excellent, excellent.
saying, I hear they're having a lot of malpractice on their record, spine surgeons in New York. They obviously did it to me. The entire spine team were conversating last night how much of a paper trail of malpractice cases they have from these patients. I didn't get to hear the rest of the conversation. Is it that they don't want to do the surgery because they don't know how, or is it and they don't like their insurance, or they just don't like the patient?
Well, you bring up a really good, here, I'll take care of it. You bring up, by the way, you guys see how small this cut is? It's tiny.
Yes, we do.
Tiny, tiny, tiny. You bring up a great question. You know, what's happening in the spine world is really, it's really sad. It's a reflection of what's happening in medicine. Here's what's happening in medicine. I hate to say this, but you all know the truth. We doctors, we go to school for a very long time. And it's not just that, you know, it's so cliche to say we went to school for a long time. But we didn't just go to school. When everybody else was out partying, we were studying in the library. It's called sacrifice. It's not because we didn't want to party. Of course we want to party. We're like everybody else. But we knew that to get the grades in order to go to a good college, we had to study in high school and be the top of the class. So we stayed home and studied our asses off. And then when we went to college, we studied our asses off for 4 more years. And then we went to med school and studied our asses off for 4 more years. I'm talking sacrifice, sacrifice, sacrifice. And then you go to neurosurgery residency and you literally work 110 to 120 hours a week taking care of patients. There's no time for any kind of fun or enjoyment. That's 7 years after med school. So there's all this delayed, deferred, quote unquote, gratification or payment. So you become a doctor and you're supposed to get paid. Then you find out the insurance companies are absolutely screwing doctors on payments. Take Dr. Berndes, for example, one of the best anesthesiologists in the country, right? He should be getting $300 to $400 per hour for his work because he's top. Guess what the insurance pays him? $30 an hour. All right, $30 an hour. How the hell can we doctors survive on that? We've been busting our ass. We've got loans. We haven't made money out of high school like a lot of people working out of high school. We got to delay. Then you become a doctor, and then you're getting $30 an hour. How do you pay off your debt? How do you pay for your house? I mean, it's impossible. So what happens is these doctors need money. I mean, let's just be honest. They need money. So they're going to look for the types of procedures that pay the most money. And that's like pain management. That's orthopedic surgery. That's spine surgery, the highest paying type of surgery there is, okay? So there's a lot of doctors that are sort of in this situation where they need to make money and they're hired to be a spine surgeon to make money for the hospital, for their department, for themselves. Yeah. And yet they're conflicted because they know those surgeries they're doing, laminectomy and discectomy, don't work. And fusion is dangerous for the patient and doesn't work, creates more problems. So it's just a really messed up situation, and it leads to a lot of malpractice, and it leads to a lot of unhappy doctors, unhappy patients, unhappy everybody. And that's where we are. And it's so simple to fix. If people just learn my techniques and started to apply them to patients, pain can be cured, there won't be malpractice, patients will be happy. I have been practicing neurosurgery for 29 years. In 29 years, I had 1 malpractice suit, and it was only because my competition saw my patient afterwards because he lost his insurance. So we went to them, and they basically threw me under the bus. He had no case, but that's 1 malpractice suit in 29 years. All right. Now, most neurosurgeons apparently they have 3 malpractice suits a year. So I should have 3 times 29 malpractice suits, but I don't. Why? Because I practice good medicine. I do what's right for the patients. I never force patients to do surgery. I always give them the option. They choose what they want to do. And I do good work. I mean, my work is excellent. To have one malpractice suit in 29 years as a neurosurgeon is really, really good. Really good. So I don't know. I don't know if that answers your question, but something has to be fixed. Our system is broken. All of these epidural injections, facet blocks, shots, pills, shots and pills, and spinal fusion and laminectomy and discectomy, all of it needs to end because it's all wrong. It's not working, and it's hurting patients. Unfortunately, there's too many what are called stakeholders. That's people holding stakes, like, prime rib and New York strip. Stakeholders are people that are financially invested and they have money coming for doing spine stuff and pain stuff. And they're controlling everything the doctors are doing. For example, Boston Scientific, Medtronic, they produce a spinal cord stimulator. Spinal cord stimulators never, ever cure pain, ever, back pain or neck pain. But they're promoting the hell out of them because they're making so much money from the insurance companies for those stimulators. But they're dangerous and they don't work. And if they work partially for the patient, and then the pain comes back or the device has to be replaced. Very bad device. I don't recommend it at all. Get your back fixed the right way with the laser surgery. Don't cover it up with a stimulator. It's like a pacemaker for your spinal cord. That said, the companies that they sell them, they want every doctor in the world to put it in every single patient in the world. That way they make tremendous profit. And that's what's wrong with our system, is that the companies that profit from selling devices are the ones teaching the surgeons what to do. They have bought the farm, and now the surgeons are basically doing whatever the companies want them to do. And that's why there's so much malpractice. And by the way, the companies that sell the stimulator, the screws, the rods, the cages, the devices that go into your spine, those companies can't be sued. They have protections. The law protects them from lawsuits. Did you know that? As long as your device passes the FDA, the patient cannot sue the device manufacturer. It's virtually impossible to win. So they just let the surgeons get sued. And they make all the profits. It's a totally fucked up system.
We have a comment coming from Frank on YouTube.
Yes, Frank on YouTube.
In context saying, Dr. Bonatti in Hudson, Florida has like 30 plus lawsuits on his license.
Yeah, I know. Dr. Bonatti's been around for a long time. I met Bonatti. I watched his surgeries for 3 days. I told them I was interested possibly in working for them. This was like 20 years ago. And he had a nice operation at one point. He actually did microdiscectomies. But the reality is, and I hate to say this, in my opinion, it's time for Dr. Bonatti to retire. Okay? I'm very happy with Dr. Bonatti from the standpoint that he challenged the standard way of doing spine surgery, which used to be, let me tell you, big incisions, folks, big, like big. Take your hand and look at your hand. That's how big the microdiscectomy incision was. And then Bonatti pioneered a less invasive way of doing it that was smaller incision, less trauma, outpatient. And so he was one of the pioneers in minimally invasive spine surgery. I give him credit for that. That was back in the 80s, okay? But he should have probably retired sometime in the 90s, in my opinion. Oh, big herniation. Look at that, guys. Wow. Sometimes we get rewarded with a nice chunk of herniation. I'm trying to get it so you guys can see this thing. Look at this. It's hard to see. We just pulled it out, but that's a good one, huh, Luis?
We can see it.
Wow. Actually got a few pieces.
Yeah.
Right
perfect.
there. Pretty big. Almost done. Probably 5 minutes left. So yeah, Bonatti has had a lot of lawsuits. I agree. Huh? What? Is she ready to go? She's doing good, huh? I'm almost done. Let me just say hi to her. Yeah, our second surgery we did, she was 3 levels. She wants to go home, and I want to say hi before she leaves. There's the tear. You guys see the tear?
Yes,
You
we
got
do.
white on the right, the fibers, they're torn like right in the middle where the blue is. Well, that blue stuff is the herniation stuck to the tear, blocking his body from healing the tear. He would have healed this tear right here, like sealed it off right after it happened, if the blue stuff didn't come out from the jelly, come out and get stuck in the tear. Now, if you get enough of this herniation, it causes spinal stenosis. What is spinal stenosis? It's narrowing of the spine. And there's different kinds of spinal stenosis. There's central stenosis, paracentral stenosis, lateral recess stenosis, foraminal stenosis, and there's extraforaminal, which is not really stenosis, but there's herniations there. In his case, he had lateral recess and foraminal stenosis. So we're going to be fixing the stenosis by removing this herniation, basically decompressing the nerves.
We have a question
Yeah, sure.
coming from the Classic Car Nut on YouTube
The classic car nut.
saying, "Hi, Dr. Duke.
Hi.
That was a large piece of herniation.
Sure was.
When does your movie come out?"
Ha! Well, thank you for asking. So, you're referring to a movie called Spine Scam. Spine Scam is now done. It's gone through editing. And we have some really interesting news on the movie. So, when you make a movie these days and you want it to be shown on the streaming services like Netflix, HBO, Hulu, take your pick, you have to do something called marketing and distribution, where you have to distribute the film. So we showed our film to some of the distributors that have connections. And the distributor that we showed it to, who's apparently a well-known distributor, he loved the film so much that he asked us if he could represent our film. And he's at Cannes. Right now he's in France at Cannes movie. What is it? The Cannes movie?
Cannes Film Festival.
Cannes Film Festival. And he's showing our film right now in Cannes to all the streamers, trying to get one of them to basically bite and offer to buy it. So we're supposed to have some answer this week. That said, the only bad thing is that if our movie gets picked up by a streamer, we're trying to sell the series. Like not just one movie, but the whole series. And the series will be, who knows, 8 to 12 films, which means we're going to have to make another like 10 movies after this one, okay? Or maybe we chop the first one into 2. I don't know. I don't know how it works. We got to figure it out. Long story short, if we're making a series, which I hope we are, then it may be another year before you see the first movie. I don't know. It's really up to these streamers and how they do things. So the movie was previewed. We did have a preview, right, Henry?
Yes, we did.
And I don't think you can actually watch the movie right now.
Not at the moment, no. You can watch the trailer, which I can leave in the chat.
Yeah, leave it the trailer in the chat.
Yeah.
But the movie is coming out soon. We just don't know exactly if it's going to be a single movie or if it's going to be a series. We want a series. I just watched a series on Netflix myself called L'Eternaut or something like that. Anybody else see that? It's takes place in Argentina. It's some kind of an invasion by aliens. And I'm thinking to myself, holy mackerel, our movie is a lot better than this. So, huh? Yeah, they start playing poker. Yeah. I mean, I didn't think it was very good, but I watched it because I was bored out of my mind. And I like sci-fi a lot. I've always liked science fiction. So I figured maybe it'll be good since it's on Netflix. But I was wrong. It wasn't very good. It was like, honest to God, it was like, I hate to say this, but a ghetto version of Walking Dead, you know? Sorry.
We
But,
have a comment coming from Frank once more on YouTube
Sure.
saying, Dr. Duke, I would love to see you do a podcast like maybe with Joe Rogan.
Yeah, I would love to do a podcast. I don't know how to do podcasts. I'm open to suggestions.
I do, but it's expensive.
What do you mean it's expensive?
The setup, trying to just coordinate everything, weekly episodes, you know, just trying.
Really?
Yeah, it's a whole structure. Not you know, you can make it inexpensive, but to get it to the quality that we want, you know, it's gonna that I envision at least might be a pretty penny.
Yeah, but when I watched Joe Rogan do a podcast, he's just him talking, right?
It's just him talking, but you look at the studio that he had.
Yeah, but we don't need an expensive studio.
Obviously not, but you want a good backdrop. You want to make
I've
it.
got a green screen.
You got a screen, but that. Now that
We should do it, man. I mean, but isn't a podcast just a video? I mean, like a live stream of
Yeah.
me talking to somebody?
Yes, now that we're talking.
Huh?
Now that we're talking, I have an idea.
It's just, yeah, let's do it.
Yeah.
If you know how to do a podcast, but
Okay.
where do you publish a podcast?
Spotify. So I looked it up, by the way, when trying to upload our live streams.
Yeah.
Spotify
5 minutes.
does not correlate with YouTube. That's the
That's what we do it on, is Spotify.
if we want to do it, get our podcasts, get
Let's
a podcast
do it,
going.
dude.
That
Let's
yeah.
do a podcast.
Okay.
Why not?
Yeah. You know what? I'm gonna look into that. If we want to do that, and actually, yeah, podcast is like a talk show. That's what Frank just commented, and so I agree.
But the question is, do I just talk about whatever I want to talk about?
Yes.
Or do I have a guest? Who should be my guest?
You can bring in guests.
Podcast the MRI review? Really?
The Duke Spine podcast.
And block out the name?
Here.
That's a great idea.
Here. What we can do. You ever heard of Andrew Huberman?
No.
Andrew Huberman. He's a. How can I describe him? He's a. He's a neuroscientist. That's what he is. He's a neuroscientist, studied at Stanford, at School of Medicine, you know, and so he has this whole podcast of him with one, either a guest talking about a certain topic or him, just himself talking about a certain topic.
Huh.
And one, I could just, off the bat, how meditation works and science-based effective meditations. And then he has someone called Dr. Lane Norton talking about the science of eating for health, science-based tools for increasing happiness. So there's all these topics that he can go around with, and I think we can do the exact same thing.
All right.
But with spine surgery, anything relating with spine, certain.
So
yeah.
is it pre-recorded, Henry?
It can be pre-recorded and edited and then uploaded.
So I could talk about like spinal stenosis, and then you could show the different types in the green screen behind
Exactly.
me.
Exactly.
Then why don't we do it? Let's do it.
Let's do it. All right. Let me.
We have so much content already.
Exactly.
We can draw on it.
Exactly. And then we can improve on that. And then also, just I'm going to have to just try to how to correlate it with Spotify, but I'm sure it's not. They make it pretty easy and accessible. So.
All right.
But
we're
yeah, I am
almost done.
100% for that.
All right.
110%.
So thank you for the suggestion.
Thank you, Frank.
We'll do it, Frank. Hey, listen, we're open to ideas. We're all about teaching. We have so much to teach. So much. We just got to get the people, you know? How do you get the people to listen? How do you get the people that need it? How do you find them? That's the hard part.
Yeah, Frank commented, Dr. Duke, when you do your podcast, you just have people call in.
All right.
That's not a bad idea, but the patient would have to be anonymous and everything if it's a patient that we do get a hold of. But if it's another doctor, another neurosurgeon, Frank, that's not a bad idea. Just for them to call in.
So maybe we can have them call in. I could answer the questions, and then Henry, you can add in B-roll behind me.
Exactly.
So that it makes it more interesting.
Yeah. That way, it's better to have it recorded than to do it live. That way, you can fix all the mess ups and the imperfections that go on with it. And trust me, Joe Rogan does that. Andrew Huberman does that. Everybody does that.
Then let's do it.
Let's do it. Yeah, I'm gonna. As soon as we're done with this, I'll look into this, because that having a podcast is, especially in today's standard, is huge.
Yeah,
huge.
I thought podcasts were like a thing of the past, but I guess they're not.
No. They're bigger and better than ever. I think like 2016, 2017, that's when the rise of podcasting really became a norm. And then Frank, once more on YouTube, commented, after you do my surgery, it will be my pleasure to give testimonials and interviews on your podcast or wherever.
Thank you. Appreciate you saying that. All right, we're just about done here with this patient. This is the last of the herniation that I'm working on with the laser. And we've really debulked this herniation quite a bit. We've gotten rid of probably about 70% of it. There's just a little stuff that's flittering around. It's not important stuff, but I always like to be as thorough as I can, get as much as I can without gilding the lily. All right, that should be good. Yep. Very good. I'm happy with that. Any other questions?
At this point, no current questions. There's a comment from WD on YouTube saying, just wanted to say hello to you all.
Hey, thank you very much. Thanks for joining us. And it's Tuesday, May 20, 2025. I'm Dr. Duke Machen. Our patient is the last of the day for us. We've done 3 surgeries today, and all 3 of them were pretty big cases. We had a patient from California, from North Hollywood, Armenian descent, which is, I am part Armenian myself. And he came here and had his back fixed. He has 0 pain. He left already. He basically went home. Yep, our second patient was from the Villages here in Florida. Huge housing development. Found out about us from another patient we fixed at the Villages. And she is ready to go home. Her back pain is gone. And this patient right here, we went on both sides. We fixed 2 discs, but one of them bilateral. You can see how small these incisions are. They're about 8 millimeters. And yeah, he's going to go home in an hour. This is 25 years of back pain gone today. Totally, 100%. It's amazing. Surgery. Thanks for joining us. Henry, you may want to show one of our patients who had surgery.
Of course.
and good morning. Dr. Duke Majan. It's July 17, 2024. I'm here with one of my Floridian patients from Punta Gorda. He just had his lower back fixed with 2 procedures, the Duke laser disc repair for some bad discs and the Duke plasma rhizotomy for facet joint pain, which we discovered when he showed up here and I examined him and found his facet joints were hurting him. You just had your surgery yesterday. You can see in the video we went in and cleaned out 2 discs and got the pressure off the nerves. We also did the Duke plasma rhizotomy on your facet joints and destroyed the pain nerves. How do you feel today?
I feel good. Yeah, I don't have any pain.
So the surgery helped.
Oh yes, surgery definitely helped. Yeah.
What was life like for you before the surgery? Why did you decide to have it?
I couldn't do anything. I couldn't walk. I still try to get around a little bit because I'm general contractor and I try to help my son out. I help the last, I'd say 6-8 months I've been in my chair and that's it. Watching TV and that's about it.
Because of the pain in the back?
Because of pain yeah.
And you've had a rough time because you had some fractures in your spine which had kyphoplasty cement put in, which looked good. And then the discs were the problem now as well as your facet joints. And we were able to fix those yesterday.
Yes, I went to a different doctor over in Fort Myers who did the cement jobs. I thought that's all I needed. That's what one doctor said. Oh yeah, you just got these 4 fractures, I guess.
Yes.
Yeah, we'll fix that. You'll be fine. Well, it didn't do anything when he fixed that.
Well, and now you notice a difference.
Yes, definitely.
And you're not on any new pain medication that we gave you.
What? I haven't taken any pain medicine.
No pain medicine.
No.
And you're still feeling like the pain is gone. So yeah, I believe it worked well.
Yes.
Anything you want to say to your friends or family out there?
No, I'd definitely recommend Dr. Duke for someone who has a back problem. Certainly this disc laser surgery, I guess, he's the only one that does it. Seems to be the best way to do it. Like I say, I would recommend it. And a matter of fact, I have a cousin that has been having problems for quite a while. And when he gets back down here, he's coming back to Florida. I'm going to have him call Dr. Duke, see if he can set up something.
Yeah, we'll take care of him. Don't worry. What's his name?
Kent LeDuc.
We'll look for Kent LeDuc. All right, sir. Well, enjoy life. Get those muscles back in shape. If you need anything, you call me. You have my cell phone.
Oh, thank you very much.
You're welcome.
Yep,
You're welcome. Thank you.